Welcome back. Now, as we promised, we'll be having a live discussion on how the government has handled the coronavirus pandemic. Do you think that there are some of the injustices that have been done in terms of isolation and treatment? We're having Lisa Owino from the Kenya Legal and Ethics Network on HIV and AIDS, Kellen, who will be having a discussion on that with us. Kellen, welcome to a live broadcast.
Thank you. So as you've noted, I work with Kellen, which is a health rights NGO that works towards promoting and protecting the right to health and other health-related human rights. Yeah, it's nice to be here.
Welcome. Now, there have been a concern that the way the government has handled the coronavirus pandemic, maybe there have been some sort of injustices, some of the human rights have been flouted. As an NGO looking towards some of those issues, from where you sit, do you think really the government has flouted some of the rights of Kenyans in handling this pandemic?
Yeah, I think the very first thing to note is that the government needs to provide lots of information. There needs to be full access to information, and not just information on the number of cases or the nationalities of the people who have contracted the virus, but the capacity of the government to actually handle the response. Like, are there enough healthcare workers? Are they trained? How many testing kits? Are there, can I go to any hospital or get tested, or are there specific facilities that I need to go to? So I think there's a lot of panic and uncertainty because there isn't enough information from the government. The government is mainly focusing on preventive measures that you should take, focusing on, okay, these are the number of cases, but it needs to be much more transparent in terms of how the government plans or how it is handling the response, because that's what gives people trust in the system.
Okay, there's been an issue of the government saying some of the preventive measures, including using sanitizers and access to cleaning your hands, washing your hands every now and then. But there are people living in the slums whose idea of sanitizers is not a basic requirement. They have a lot of things to grapple with. Do you think the government has handled this issue properly? Have they given sanitizers to those who cannot access such basic needs?
I think the thing that the government has done is just importing whatever response has been adapted in the Western world and bringing it just cut and dry into the Kenyan context without actually appreciating maybe the other socio-economic issues where if I live in maybe I wouldn't want to spend 700 shillings on sanitizer and would prefer to use water and soap. So the core of it is remembering that the government still has duties to sort of facilitate certain things like water, housing, sanitation, which all now feed into the right to health. So if I can't access a sanitizer or afford a sanitizer, I should still be able to access water because that's a basic need and that's a right that I have under the Constitution. So it's actually up to government to move beyond telling people, okay, buy sanitizers and to start working towards now these underlying determinants like water, housing, sanitation, education.
There have been some correlation between tuberculosis. Recently, on the 24th of March, we commemorated the World TB Day. There has been some sort of a correlation between TB and corona in terms of the way of isolation and the kind of treatment that comes with that. Do you think correlating the two, looking at TB and corona, is the government really learning from how we handle TB to now handling corona, because it's just a matter of isolation and the treatment that comes with it?
I think it's actually very good that you've pointed out that correlation because it shows that we aren't, government isn't starting from zero. So in 2010, Kellen started litigating this case where 3 men were arrested and imprisoned for not adhering to their TB drugs. And this was in line with the government policy or sort of the framework at the time. So after the result of the litigation was the court saying that government needs to actually develop an isolation policy that recognizes involuntary isolation doesn't equate to criminalization.
Right.
So, and this policy exists, like the isolation policy for TB was actually developed and enacted, yes. So it's not like there's completely nothing, you know, isolation isn't a new thing.
In the country.
It's not a new thing in the country, it's not a new intervention in health. It's just how isolation is handled has to be rights-based. You know, you can't equate isolation to a criminalization that, you know, we're isolating you because what you're doing goes against
the rights of the nation.
Exactly. Even in isolation, it's very important for the patient to still access rights, because isolation isn't just to prevent them spreading the disease, but also to facilitate their own treatment. So so they need to access basic nutrition, have access to information as well, you know, not just put in there and be told you'll be here for 14 days.
When the coronavirus case was first reported, the government had the rule of self-quarantine. The people who are getting a JKIA will be told to self-quarantine at home for 14 days, but it came to a situation whereby it was now mandatory. Now, for the way the government has handled the issue of mandatory self-quarantine, some of the people who have jetted back into the country have complained they are being put on mandatory self-quarantine, they are paying, they were not prepared for that. Do you think the government should have cushioned some of these people who are not prepared for this mandatory self-quarantine period?
In fact, I think that the government definitely has a duty to cushion everyone, because there's a huge socio-economic implication to being a citizen, but then coming and being involuntarily isolated at my own cost. What if I don't have the means? Does that mean I'll be told to go? Will I be put in jail? Like, that's not clear yet. And that's why it's very important for government to give us all this information, because as it stands, we don't really know how this mandatory isolation or mandatory quarantine is working. We just know you have to do it, and you have to do it at your own cost. But if I can't afford it, then what?
There has been a concern that there has been discrimination of citizens from other races, Italian, Chinese. Recently there was a clip of Chinese in Kibra who came into the neighborhood, and there was some sort of panic. The residents there started attacking them. You know, there was some sort of misinformation on corona. Do you think the government is doing enough to ensure that there is no discrimination of other races that have been perceived to be having the many cases of coronavirus?
So I would tie this all back to the lack of information. When there's a level of uncertainty on the ground as to who has or rather how the disease is contracted, and then when you listen to the information that's been given, it's just telling you, okay, it's a certain number of foreign nationals have it, they're the ones who brought it into the country. So the narrative is very much stigmatizing in and of itself. It's not that, okay, there are patients with a disease that anyone can contract it, and one Mexican and X number of Chinese, X number of Italians imported, you know, they came with the disease. So that lack of information, and we see it on the ground with so many other diseases as well, with TB and with HIV, lacking information. You've seen that at the community level, people will say TB is like it's witchcraft. You get TB
There's
because
misinformation
exactly
that.
That lack of just widespread, comprehensive information. It's what causes now this intense stigma, because you know, people just make the connections that seem relevant to them. Okay, it started in China, and therefore it is a Chinese disease.
Since Kellen has been here since 2001, perhaps what are some of the measures that you have done to fill the gap that the government has not done in terms of giving information to the public to ensure that more people are sensitized in some of these diseases that have been termed as pandemic over the years?
I think we have done a lot on working at the community level in terms of spreading information, but also in terms of building the capacity of communities to go and ask for information from government and to demand that government fulfills its duty to consistently provide comprehensive information. So we work with a lot of community-based organizations, sort of providing technical knowledge on the processes, on the information that we have, on the rights issues that surround certain health issues like HIV, like TB, they're now at the community level where, you know, wako kwa grao, they actually now talk to their own communities, to their people, and get now the information spreads that way,
Now, there has been an issue, some of the people have said the Ministry of Health has somewhat taken a grip of giving information on how the coronavirus pandemic is ongoing in the country. Being that you are an NGO, of course, observing the different departments or different ministry of governments on how they are handling several issues that concerns health, do you commend the Cabinet Secretary Mutahi Kagwe on how far, on how much he has handled this particular situation? Do you think the government has a grip on this?
We definitely, or I definitely feel they should be commended for the strides they have made so far. You would see that even in the press briefing yesterday, there was a lot more information in terms of how much money they're allocating to certain, maybe to training of healthcare workers, how much money they want to allocate towards cushioning the blow to the economy, that sort of thing. And that's what we need to see more of. Like, while it's commendable that they have been providing information and have been doing it consistently, it needs to be a lot more information. Like, how are they going to use the money disbursed from central bank in the response? What are their priorities in using that money? So they should
go to the nitty-gritties of what they're doing.
Yes, not just general, you know, piecemeal information, but in depth. Yeah, for sure.
Okay, there has been a curfew that was given by the President Uhuru Kenyatta that will start tomorrow at 7 p.m. From where you sit, do you think the curfew really will help in ensuring that the spread of coronavirus is curtailed, given that it is also a legal issue that now Kenyans have been given a 10-hour curfew? From where you sit, given that you look into the legal issues in terms of health system, is it a recommendable action taken by the government?
So there is definitely this recognition that during emergency situations, governments tend to take extreme measures. And what NGOs and what we tend to emphasize is that whatever measure is taken actually follows certain principles that have been agreed upon in the international sphere. So if you're limiting a right, then it has to be necessary. You have to have made sure that there aren't other less restrictive means of achieving your goal. So maybe perhaps they weighed a curfew versus a lockdown. If a lockdown is more restrictive, maybe a curfew seems less.
More,
exactly.
It can cushion a section of the public or not really curtail the whole thing.
So I can't technically tell you whether it will curtail the spread, but I can tell you that they need to follow certain principles to get a bit legal, but they're called Syracuse principles on when to, or the conditions that have to be met when you're limiting a right, in this case now freedom of movement during an emergency situation.
All right, there has been a concern really that public transport having been curtailed, the bars have been closed down. There's been a concern that a section of Kenyans, especially those who are casual laborers, might lose their jobs due to some of the directives that have been given by the government. As an NGO that has been acting on the legal health system and looking at the issues of injustices, have you seen a way of ensuring that some of these casual laborers are somewhat cushioned in cases of directives such as this that are being given by the government?
In the end, the buck stops at the government. They are the one. We voted them in. They have the power. They have the reach needed. And this is actually a very core issue because I want to say up to 80% of the Kenyan population is made up of casual laborers, washing mamas, people who work at the mjengo on daily wages. And if they can't access, those funds anymore, they can't pay their basic needs. They can't pay rent, they can't buy food. And that's why it's very important to us for the government to actually be clearer about how they are planning to do this social protection. In the press briefing yesterday, the president noted that 10 billion has been allocated and that the Ministry of Social Protection shall disburse those funds. So we need to, what we being all of us, including media and the citizens, need to know is how is that actually going to be done? Is there a measure that they're going to take? Is it going to be people who work in the informal sector? Will it be people who live in informal settlements? How much will they be given? When will they be given this money? At the end of the day, government has a duty, and a very strong duty, in making sure that there isn't an intense financial hardship that a casual laborer or someone who works in the informal sector will suffer because of a government directive. Yeah.
There was a case of Kilifi Deputy Governor Gideon Mwamburi, where he caused a reckless move. After being given the directive to self-quarantine, he of course flouted the directive by the government, and Health Cabinet Secretary Mutahi Kagwe of course said that once he is treated, they will invoke the Public Health Act, of course, terming his move as reckless. Also, tonight in our bulletin, we had an issue of a defiant priest in Kitui who did the same. Now, when it comes to that, is it okay for the Public Health Act to be invoked to charge some of these people who have been told to endanger the life of Kenyans?
I think I would go back to the TB example. As we've seen from TB, as we've seen from HIV, as we see from the every level, from community to global, that using criminal sanctions to sort of forward a public health intervention never works. Instead, all it does is create this environment or this situation where people feel stigmatized, so they even are afraid to access treatment. So even if I suspected I have COVID-19, maybe I was in an airport and I flouted the self-quarantine, then I suspect I have it. But if I go to a facility, I won't want to go to a facility lest I'm criminalized or I'm charged because of flouting self-quarantine. So I'll be there with the disease, maybe spreading it, continuing to spread it, because there's this environment that has created fear in me. Like, at the end of the day, public health interventions should focus on actual public health aspects. And the core of it is enabling people and populations to actually exercise the right decision, and criminalizing or putting criminal sanctions never actually reaches that goal. Having full information helps towards that. When you have full information, it enables you to understand, okay, I really need to self-quarantine, because if I go out, the health system actually can't handle it if there's a mass contraction of the virus.
But it has been argued for the case of the DG, Gideon Mwamburi, since he was the leader, and of course he knew that coronavirus, given that he had come from Germany, of course he knew the coronavirus is a pandemic, and it was expected that he's a leader, he's responsible. Maybe the first thing he should have noted, since this is a government directive, it is really important that I follow it. But now looking at how really he handled it, some might say maybe he really flouted some of the rules and the regulation that had been given concerning this issue.
I think it's easy to make that direct connection, but if the DG didn't have, if you don't if you're not given full information, you'll never see the relevance. So if you're told to stay home, but to you hear, okay, there are only 31 cases, only one person has died. Okay, really, is it? Is it that serious? The government hasn't told you, you haven't accessed the information that, okay, this, because of how quickly it could spread, that the sort of strain it could bring on the Kenyan health system, we wouldn't be able to handle it. And that's what we're trying to curtail. But if you're only given, piecemeal, it makes you less receptive to actually exercising the directives that government gives. So it all ties back to information. And this ties back to the TB example, where TB patients would even go to facilities and be told, if you don't keep taking your drugs, you'll be jailed. But they don't tell you that actually adhering to your drugs, because you take 4 pills a day for up to 8 months, and you need to consistently be eating. If you don't have the means to consistently, to meet your nutritional needs, then you might choose to stop taking drugs because of the effect it has on your body. So recognizing that there are other things that feed into health decisions, not just knowing that there's a virus and I could spread it.
Now, due to the perception that really there is some gap when it comes to giving the public information, Do you think there are some of misinformation that have caused panic decisions in terms of handling the corona pandemic so far?
Yeah, for sure. Whenever there is a lack of information, there'll definitely be, people will exploit those gaps to forward misinformation, like the chloroquine example, that chloroquine can actually
be a sanitizer.
Exactly. So again, if government channels information and channels it, makes sure that it's widespread. Perhaps I don't have access to a TV, so I won't hear a press briefing. Maybe I'm blind, maybe I'm hearing impaired, so I won't actually hear what he's saying, so I need to access a written document. If I'm blind, I need something that's in braille. So making sure to take those steps to spread information and to make sure it reaches the most marginalized, the most underserved populations will help curb the spread of misinformation. Because again, the buck stops at government in providing information. They have the most reach, and they do have access to technical expertise that an ordinary mwananchi wouldn't have.
So as Kelly, and from where you sit, you think maybe if the government gave information as required, the coronavirus cases or the coronavirus pandemic will not have come this far to a point that we're talking about a curfew or a possible lockdown?
Well, I cannot predict how the spread would have gone. Again, I do not have medical expertise, but for sure, providing full information would lead to people following the directives more. Having full information and providing socio-economic cushioning for those who need it would lead, okay, fine, I can stay at home, because for me, I can stay at home because maybe my employer facilitates it. So if I was a casual laborer and received maybe food from the government or a rent break from my landlord, then I could actually consider staying at home. Then if I'm told, okay, we're giving you this money, and on top of that, you really need to stay at home because if you go out, you may contract the disease, you might be immunocompromised and you don't know it. So actually try and stay at home and curb any, unnecessary movement, unnecessary contact, then I'd be more amenable to following that directive if all that information was provided. But again, it's the parent-child example. When a parent just tells you not to do something, you don't really take it seriously until you know the reasoning behind the restriction.
So what can we really learn from this corona pandemic? Because people have said, okay, corona has come, we are more personal hygiene is something that you're really considering as a nation. So after corona pandemic has come and gone, what are some of the things that we should learn from as a government, as a nation, as a community, and as a society?
I think what we all need to learn is that our health systems need to be strengthened, because this corona isn't the first pandemic or epidemic that Kenya has faced. We've had we're still a very high burden TB country, still a very high burden HIV/AIDS country. And these are pandemics that we have lived with for years now. So the core that we need to, the lesson that we need to carry into the future is that our health systems in general need to be strengthened. Like, don't wait for a specific pandemic, then now channel all your money or all your financing, all your resources into dealing with that pandemic, but actually strengthen the health systems as a whole, like the building blocks of the health system, the health workforce. Make sure you have a well-trained and available health workforce. Make sure you have mechanisms for providing health information to the public. Make sure there is health leadership and accountable and transparent governance. So we know where resources are going. We as citizens can participate in sort of the setting of priorities in health. If we feel maternal health is something that should be funded or that should be financed at the national or at the county level, we need to have the ability to actually tell our governments that. So the lesson that we all need to learn from this is we need to work towards strengthening our health system as a whole, because it's unlikely that corona will be the last pandemic that we face.
As an NGO, your main work is about advocacy and networking, of course. When it comes to service health delivery and looking at the human rights, some of the Kenyans do not even know if their rights are being flouted. So what are some of the things that you will point out and say, this should not be done, this is against the law? what are some of the things that you will point at to show the common mwananchi that when this is done by the government, this is not what you should take as a lying issue?
I think first off, that comes from this perception that you receive services from government as a beneficiary. You know, if you get any service, it's a benefit, and not that you're entitled to actually get services. So sort of shifting the societal mindset from that of, oh, I'm a beneficiary, to that of, okay, I deserve this, it's my right under the Constitution. So just, I mean, as NGOs, the unfortunate thing is perhaps we have more limited reach than government does. So yes, we do work with communities, we do work with other civil society and other partners to make sure that people know about their right to health, but we also agitate government and demand that they also educate citizens on the right to health.
All right. Okay, my director Paul tells me we are pressed on time. Perhaps what will be your final word or your way forward, or a piece of statement that you love to contribute in terms of coronavirus pandemic, and of course looking at how the government is doing so far and anticipating what maybe are some of the measures that the government might do moving forward?
I'd say 3 things to wrap up. We need full information, we need comprehensive information. We need all processes for government need to be transparent, and we need to be able to hold them accountable to how they're spending resources, to how they're dealing with the pandemic. And we need to move from this knowing that we work towards a stronger health system and work towards fulfilling these underlying determinants to health: water, food, sanitation, environment, housing. You know, those would be my closing remarks. Remember, and a last one, I guess a final one.
All right.
Being a patient isn't being a criminal.
Okay.
Yeah.
Thank you so much, Lisa Owino, for making time for us. Lisa Owino is from the Kenya Legal Ethics and Network on HIV and AIDS, of course, telling us about the issue of coronavirus pandemic, what the government is doing. Is the government doing enough in terms of handling this pandemic? We'd love to have more, but that is all you can have for this particular discussion. Communicate to us or send your feedback at KUTV Kenya on Facebook and at KUTV Kenya on Twitter.